You walk into a meeting room, your heart suddenly hits 170. Your chest tightens like an invisible hand is squeezing it. And in that moment, you think, am I dying? If that's ever happened to you, keep listening, because what I'm about to explain might completely change how you experience these moments. Here's what's actually happening. Your brain made a mistake. It treated a social situation like a physical threat. That's it. That's the whole problem. Deep in your brain, there's an alarm system called the amygdala. In social anxiety, this alarm goes off way too easily. Your body can't tell the difference between standing in front of people and standing in front of danger. So what does it do? It activates the same emergency system. Fight or flight. Your heart starts pounding. Your breathing gets shallow. You might sweat. Your hands might shake. And here's where things get worse. You notice your racing heart. Then you think, why is my heart beating so fast? Something must be really wrong. That thought creates more fear. More fear releases more adrenaline. More adrenaline makes your heart race even faster. It's a loop, a panic loop. The more you feel your heart beat, the more you panic. The more you panic, the faster it beats. Then you start thinking, am I having a heart attack? Should I call 911? And right there in those few seconds, the panic loop is fully triggered. But here's the truth you need to hear. This is your brain misinterpreting signals. Your heart isn't broken. You're not dying. Your body just responded to a false alarm. Now, you might be thinking, but how do I know it's just anxiety? What if it really is my heart? Let me give you the answer that will help you feel safe. If your heart rate only spikes in social situations and then comes back down, it's almost definitely anxiety, not a heart problem. Period. Here are the clear signs this is anxiety. Your heart races when you're about to present or when you walk into a crowded room, but not when you're exercising or relaxing at home. That's anxiety choosing its moments. Real heart problems don't work that way. Second sign, your heart rate comes down within a few minutes after the stress passes. Heart conditions don't resolve themselves that quickly. Third, you don't have crushing chest pain shooting down your left arm or up into your jaw. You don't feel like an elephant is sitting on your chest. Your heartbeat is fast, but the rhythm is regular, not chaotic. If you've had panic attacks before and you're constantly aware of your heartbeat, that also points strongly to anxiety, not cardiac issues. Now, there are times you should get checked out, not because something's wrong, but because that reassurance helps break the anxiety cycle. If your chest hurts during exercise, if your heart skips beats or feels irregular, if you fainted or almost fainted, if young people in your family have had sudden cardiac death, if your resting heart rate stays above 110 even when you're calm, those situations get checked out for peace of mind. But again, if your heart only races in social situations and then calms down, you can be confident this is anxiety. So what do you do when you're in that moment, when your heart is at 170 and you want it to come down fast? I'm going to give you 6 techniques. These work, and they work immediately. Method 1. Long exhale. Breathe in for 4 seconds. Breathe out slowly for 6 to 8 seconds. Do this for 1 or 2 minutes. This activates your body's brake system, the vagus nerve. It tells your body, we're safe now. Method 2. Physiological sigh. Take a breath in, then take another little sip of air on top. Then let it all out in one long exhale. Do this 3 to 5 times. This rapidly stabilizes your heart rate. Method 3, cold water. Splash cold water on your face or hold ice to your forehead. This triggers something called the dive reflex. Your body thinks you're diving into cold water, so it automatically slows your heart to conserve oxygen. People bring their heart rate from 150 plus down to normal in 1 or 2 minutes with this. This really works. Method 4, relax your jaw. Right now, you're probably clenching your jaw without realizing it. A tight jaw signals danger to your nervous system. Open your mouth slightly. Let your tongue rest. Release all that facial tension. You're telling your body, we're safe. Method 5, ground yourself. Press your feet into the floor. Touch something solid like a table or wall. This physical contact tells your brain you're safe right now. The racing heart is just a false alarm. Method 6, gentle movement. Not intense exercise that makes it worse. Slow walking. Roll your shoulders. Gentle neck stretches, maybe some shallow squats. This burns off excess adrenaline without triggering more anxiety. These are your short-term tools. They help you not fall apart in the moment. But what about preventing this from happening in the first place? That requires a different approach. Think of it in 3 stages. Short-term, the techniques I just gave you, they stop you from spiraling right now. Medium-term, you start training your brain that these situations are safe. This is called gradual exposure. You expose yourself to mildly anxiety-provoking situations in small doses. Maybe 3 to 5 minutes at a time. You say hello to a cashier. You make small talk with a neighbor. You have a brief conversation at work. Each time, your brain learns nothing bad happened. It recalibrates its threat detector. Long term, this is where real change happens. Regular exercise is probably the single best long-term solution. Not exercising during panic, but consistent exercise over weeks and months. It strengthens your vagus nerve, your heart rate recovers faster from stress, your nervous system becomes more resilient. You also want to stop monitoring your heartbeat constantly. Stop checking your pulse all the time. Stop wearing a heart rate monitor all day. The more you watch it, the more likely you are to panic when it goes up. What you resist persists. The more you try to control your heart rate through sheer will, the more anxious you become. And here's the most important shift you can make. Change what a racing heart means to you. Right now, when your heart races, your brain says, something is very wrong. But what if you reframed it? My body is getting ready to help me. Because that's actually what's happening. Your heart is pumping more blood to help you perform. Athletes before competition have racing hearts too, but they interpret it as excitement, not danger. This is your body helping you, not hurting you. Let's talk about breaking that panic loop. The key is not fighting the sensation. When your heart starts racing and you think, no, this can't happen, I need to stop this now, that resistance creates more fear. More fear creates more adrenaline creates more racing heart. Instead, try acceptance. Okay, my heart is beating fast. That's what it does sometimes. It's uncomfortable but not dangerous. It will pass. This acceptance interrupts the loop. Another crucial thing, don't run away the moment your heart starts racing. I know you want to escape. You want to leave the meeting, leave the party, leave wherever you are. But every time you escape, you teach your brain that the situation really was dangerous, that you needed to flee to survive. Instead, stay for just 30 to 60 seconds. Use those calming techniques. You're teaching your brain, I can handle this. It's not actually dangerous. Let me give you a simple decision tree for the next time your heart races. First question, am I in a stressful or social situation? If yes, there's a 90% chance this is anxiety. Second, do I have severe crushing chest pain shooting to my arm or jaw? If no, keep observing. Don't panic. Third, do I feel like I'm about to faint? Is my vision getting dark? If no, this is very likely anxiety. Fourth, does my chest hurt when I exercise? If no, your heart is probably functioning fine. Fifth, is my heart rate gradually coming down? If yes, this confirms it's anxiety, not a cardiac emergency. Here's what I want you to remember. Your heart isn't the problem. What scares you isn't the heartbeat, it's your misinterpretation of what that heartbeat means. And that misinterpretation can be retrained. You're not broken. Your heart isn't failing. You just learned a false fear response. And just like you learned it, you can unlearn it. Your body's trying to protect you. It's just protecting you from the wrong thing. Once you understand that, once you practice these techniques, once you slowly expose yourself and prove to your brain that you're safe, everything changes. You have the tools now. Use them. Be patient with yourself. And remember that racing heart is uncomfortable, but it's not dangerous. You're going to be okay.